This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into Mon Health Talk. Dave Wilson with you. Our guest this morning is Dr. Brad Warden, Executive Director and Interventional Cardiologist with Mon Health Heart and Vascular Center, Chief Administrative Officer, Mon Health Medical Group. Dr. Warden, good morning. Good to talk to you again.
Good morning. Thanks for having me.
Hey, thanks for taking some time. We're going to talk about cardiac telemedicine today, but before we dive into the topic, I want to talk about you. Well, just for a moment at least. Give folks a little bit of an idea about your background, education, and how you ended up with Mon Health.
I am one of the unusual people in that I'm actually from Morgantown. I grew up here. I was born here in 1960 and have been practicing medicine here for 25 years. So, I went to Washington Jefferson College, came back here, actually worked for Milan for several years, and then went back to medical school. So now I'm at Mon Health.
What drew you to cardiology?
I really liked working with my hands, and technology was moving so quickly in the cardiac field that it was very attractive. I thought about interventional radiology, but you don't get to see patients long term and take care of them. And I see some family members that I see 3 generations of their family, so I really enjoy that.
Explain the specialty interventional cardiologist. What does that entail?
So things like work in the cath lab, so putting stents in patients. If you're having a heart attack, when they come into the emergency room, I would be the doctor if I was on call that they would communicate with, and I would come in and emergently open an artery to stop a heart attack from continuing. And then there's other parts of it, including structural heart, where, now aortic valves can be replaced by going through the arteries in the leg and up into the heart itself, repairing valves using special clips can also be done now. So there's a lot of movement towards being able to replace the other 2 major valves in the heart, the mitral valve and the tricuspid valve, by being able to do that from access from the legs, et cetera. So a lot of changes over the course of time. My father was actually the first heart surgeon in the state of West Virginia, and all these procedures used to be done open, and now their technology is moving ahead, and we can do that by just putting a needle into the leg and going up through the arteries. So a lot of improvement, a lot less downtime. Patients can go home the same day, whereas before there was, days in the hospital and then months of recuperation from a lot of these procedures.
Dr. Brad Warden joining us this morning. You're joining us, and I said we're talking about cardiac telemedicine. Explain this new partnership that is going to make this available.
Well, telemedicine has been around for a while now, and it's the ability to communicate with patients, whether they're in another hospital or at home, using the computer. And so the upside to it is that patients can get care at home, especially people with limited transportation access, et cetera. So that works very well. But in the past, just having the communication to see the patient and talk to the patient, some specialties lend themselves very well to that. But for cardiologists, part of the physical exam is listening to the heart, listening to the lungs, and so forth. And the technology is available now to be able to have somebody at a site. So in this relationship is going to be with the Parkersburg PARS Healthcare. So they're going to be bringing patients into their office in Parkersburg and there'll be a person there that will tend to them while they're in the office. But when we're communicating with them virtually, they have the ability to use a stethoscope, place it on the patient, and I can listen to their heart and listen to their lungs remotely from my office in Morgantown.
So what is the advantage to the patient? In this case, you're going to be working with the facility in Parkersburg. What's the advantage to the patient in Parkersburg through this new partnership?
Well, patients really prefer to get their health care close to home. We don't think about it as being the big city, but there's a lot of patients that say, oh, I won't drive to Morgantown because of the traffic and because it's difficult to drive there, et cetera. They don't like to drive into Morgantown to come into appointments, and this allows them to perhaps go 5 or 10 minutes down the road instead of the 2 hours up here to come to an office appointment. They can go to 5 or 10 minutes down the road to the office in Parkersburg, and I can see them, communicate with them. They can communicate with me, and then I can listen to them and so forth and do a complete exam on the patient. So it's a big advantage. Like I said, some people are very limited in transportation. They don't have somebody that can take a day off to drive them up to Morgantown to have the appointment and drive them back home. This is something that's available much closer for them.
Let me flip that around. There are also some patients, I'm sure, right now who are thinking, I want to see a doctor. I want to see my doctor face-to-face. I don't want to talk into a computer or a camera and have them be, in Morgantown and I'm in Parkersburg. So just walk me through what would a visit to this facility in Parkersburg and a cardiac telemedicine visit, how would that go? What would that be like?
Well, they would check into a clinic just like any other clinic. They've built a beautiful suite down there in Parkersburg, and they place the patient on an exam table, and in front of them is a camera and a large television set where I'm actually larger than life, but and we'll communicate real time so that you can see me. If patients prefer to have appointments in person, we always have the availability of that. It just requires a lot more work on their part to travel this far. But this allows us to be there, when they need us. We also do, in a lot of places, telemedicine in the hospital. So in some of the hospitals that don't have cardiology services, and the hospitalist or the primary care doctor that's taking care of the patient in the hospital can consult us, and we can see the patient in the hospital, but they may be, 50, 75, 100 miles away, but we can see them while they're in the hospital and do consults on them also.
So for the patient, it will be just like going for a doctor's visit. You're just going to be on TV.
That's correct. And the way that it's set up, that I can see you, I can share documents. If I have results, I can let them actually view the results on a screen that I can share with them on the television set. It's interactive. It's real time, and there is a face. There's a person right there, and I'm seeing them as a person on the computer screen. I like being face to face with people too, but it just gives people another option if they don't have that ability to travel.
Dr. Brad Warden is our guest this morning, Executive Director and Interventional Cardiologist, Mon Health Heart and Vascular Center, Chief Administrative Officer with Mon Health Medical Group. We'll continue our conversation right after this. You're listening to Mon Health Talk on the voice of Morgantown, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Dr. Brad Warden, Executive Director and Interventional Cardiologist, Mon Health Heart and Vascular Center, Chief Administrative Officer, Mon Health Medical Group. We're talking about cardiac telemedicine and what went into the decision to choose PARS Healthcare for this cardiac telemedicine.
Well, we're always looking to partner with people that have similar approaches to medicine. we are a patient-centered hospital, and we want to work with people that are similar. This group has started and has grown rapidly. They have 11 primary care physicians. They have general surgery, neurosurgery, imaging capabilities. And in the Parkersburg area, it also allows them some choice as far as, which healthcare system they'd like to get their healthcare, their cardiac healthcare in.
So when does this program go live? When can a patient actually go to this facility and see you?
The 17th of this month, we start off the first clinic then. So their availability of appointments, and they're already scheduling appointments further down the road than that.
So how do patients make an appointment? Is this a referral basis? Can they reach out on their own?
Yeah, it's a referral basis. We've provided a special referral form to not only this practice, but the other primary care practices in Parkersburg. And so if they'd like to make an appointment there, they're welcome to refer into the system, and they'll get those appointments scheduled.
I grew up not far from Parkersburg, so kind of familiar with, I'm actually very, very familiar with the area there, but why Parkersburg as a location for a cardiac telemedicine facility other than the great partnership there with PARS?
Well, the truth is, unfortunately, West Virginia is leading the nation as far as cardiovascular death. We still 25% of the population of West Virginia smokes. We are usually in the top at least 5 when it comes to diabetes and obesity and hyperlipidemia. So those are the risk factors for heart disease. So it's very prevalent in the population, and we need to provide access. That's really one of the big problems with healthcare in the state of West Virginia. You look at access, not only from just being able to get appointments to see doctors, but also, like I said, transportation is a major issue. And when you talk to patients that live in the rural communities, one of the reasons that they say I don't go to the doctor is because I physically can't get there. I physically can't get somebody. I don't have family that's close. It's too expensive for me to take a cab. They perhaps don't have the availability of Uber or can't afford that in order to get to their appointments. So they don't get in to see the doctor, so they don't get the appropriate care that they need to try to reduce these risk factors. And because of that, we think it's important to lower the burden for patients to get in and see us in the clinic.
Talking to Dr. Brad Warden, is this something you see expanding in the future, and there could be these sites in small towns and smaller communities all over the state?
That's exactly what we see. We think this is important. We think that this is a major part of healthcare for the future. We also have the technology to actually communicate with patients, although you don't have the part of the physical exam. So that's the part that you get when you're in the clinic. But to actually being able to communicate with patients on their own phone or their own computer in their home, and being able to have telemedicine appointments with them that would eliminate the need for them to travel at all. But again, at least at the initial appointments and so forth, or when things change, you want to be able to do a physical exam. That's an important part of an evaluation of a patient.
I got to ask you this because we've talked several times. Your dad was the first heart surgeon in West Virginia. What would he think of these types of advancements where you're seeing patients from your office in Morgantown and they're in Parkersburg, and somewhere down the road they might be in Grafton or they might be in Beckley. Who the heck knows where they might be? He would be amazed with all this, wouldn't
he? He would have been profoundly amazed. He was a person who kept up with the times, though. And when I was trying to decide on what I wanted to do, of course, he would have, liked for me to be a surgeon. But when I said that I was going to do cardiology, he said, I don't blame you. In this day and age, I think most things are going to move into that realm, into the cardiology realm from the open surgical realm. So I think he knew what the future was going to bring with some of those, with these new technologies. Now, he didn't probably realize that computers would be a major part of that, but he was a person that kept up with the current technology, when he was alive, and always practiced at a cutting edge. And I think that's important for all doctors to remain current and try to use the technology that's available to make caring for patients easier for the patient.
Dr. Brad Warden joining us this morning. I always enjoy our conversations, but I half-jokingly say this when I talk to a lot of physicians on the program here. My goal is to not come see you, so how can we avoid coming to see you for any of the procedures, any of these types of surgeries and operations and interventions that you handle?
The real mainstay of staying away from the cardiologist is prevention. So I would go see your primary care doctor, and your primary care doctors do a great job of looking at you as a whole and doing those things that, talking to you about smoking, talking to you about obesity, putting you on diets and exercise plans, looking at your cholesterol and appropriately treating you. There's just all sorts of things that you can do now. There was a point in time, 50, 75 years ago where, if you had a certain disease that was a risk factor for coronary disease, there wasn't a whole lot you could do about it. Now there's lots of medicines out there, and people say, well, I can't take this one medicine, say, for my cholesterol. But now there's lots of other options out there for people to medications for people to take for cholesterol, in addition to lifestyle modifications. So primary care physicians are just absolutely imperative, for people to go to try to get their risk factors under control and avoid, like you said, having to go through a lot of those procedures.
Dr. Brad Warden, our guest this morning. You can get more information over at monhealth.com/heart. Dr. Warden, always good to talk to you. Thanks for taking some time this morning.
Absolutely. Great to talk to you, too.
Appreciate it. Thank you very much. Dr. Brad Warden, Executive Director and Interventional Cardiologist, Mon Health Heart and Vascular Center, and Chief Administrative Officer with Mon Health Medical Group.